Welcome, everyone. If you want to take your seat. Thanks so much for joining us today. We were going to apologize for the drive, but then we realized it was such a treat that there was no apology needed. And there may be a little irony in sitting in this extraordinary place, given where the world is and where many of our clients that we serve are. We both want to acknowledge that. And nourishing our souls is important. So hopefully this day can be nourishing for you on many levels. And both of us feel strongly about the importance of connection. And the networking that we do today, we think is as important as the incredible presentations. We hope they'll be just as incredible as we are feeling them to be. But so meeting people that you don't know today is something we think is important, as well as deepening your connection with the people that you work with. I realized that I didn't say my name. I'm Jen Hastings. I'm working with the Health Improvement Partnership. I also am a provider with Planned Parenthood, and I've recently been working with Encompass to try to bring buprenorphine to the residential treatment that they provide. So thank you for coming. We're going to do a little bit of logistics first. You got very full packets. On the right side of your packet are the materials related to today's presentation. We asked each presenter to do a one-page description of the program that they're sharing with you today. So that's what's on the right side. In addition, we also have the agenda itself and then your evaluation. We read the evaluations, we really take them seriously, so please do take the time to fill them out before you leave today and leave them with us. On the left side are additional materials that we thought might be helpful to you, and I want to point out in particular the three items from Integrated Behavioral Health Partners. Karen and Jen will be with us today, and they're, I think, already here in the back taking notes, and they'll be kind of doing a reflections piece for us together that we're really excited about. But I didn't know about these items until this morning, and just looking at the packet, I think they're really rich and very relevant to your work. In addition, there's a description of state Medi-Cal and the behavioral health funding and how that works. And if your patients are mild to moderate, they are at this point the responsibility of the health plan. And if they're more severe, that's the responsibility of the county. That's been confusing for a lot of people over the, since this came to be. Okay, I think I have to stop talking now. And welcome Shelley, who's just been so amazing in making the Integrated Behavioral Health Action Coalition just a vital and important part of our day-to-day life. I want to thank you deeply for the work you've done over the years. Thank you.
So the one other housekeeping thing I wanted to mention is if you need the password for wireless, it's on this slide, and we'll put this slide up during transitions throughout the day as well. And I have 3 slides in introduction. Some of you in the room know more than I do about Health Improvement Partnership because you fostered its initiation and brought it to where it is today. And others don't know much about HIP at all. So this is our mission statement, and there is that trifold on the left side as well. And I will just say that there's a lot of us from Health Improvement Partnership today here, in addition to myself, and I increasingly see, we talked about, well, can we justify having everyone come today? And the answer is absolutely yes, because so much of where I see our work heading is really around this: how do we work together towards care coordination and staying rooted in what people in our communities need? So enough said about that. You can read if you're intrigued or don't already know. I also wanted to acknowledge the sponsor for today is Blue Shield of California Foundation, and they have funded HIP's work in behavioral health for several years now. And I wanted to just give that slight, quick historical perspective that started in 2014, early January 2014, and the initial grant that HIP received to help integrate behavioral health was around innovation in safety net primary care. So that work really helped to foster, and Karen and Jennifer were engaged as consultants in some of that work. That work really helped to foster implementation of mental health parity in the primary care safety net and dramatic increases in the staffing there. So then it transitioned into this body of work, this advancing integration through community collaboration. So April 2014, what is now IBHAC, terrible acronym, but Integrated Behavioral Health Action Coalition was launched. And I just want to say I'm so delighted, because when I look across this audience, I am so pleased that I think the right people are in the room to help move change. And many of you were at those initial meetings and have been at the meetings, near monthly meetings, for over 2 years. And IBHAC has had sustained participation of around 20 organizations and 25 to 40 people at every monthly meeting since April of 2014. So all of that trust and transparency and understanding who each other is and what the work we do is, I really think has made a difference already and will continue to. So lastly, why we're here today. So in July of 2015, we together, collaboratively, finalized a charter and got signatures from member organizations, and these are the core components. And so Blue Shield asked us at the end of last year's grant period, so a year ago, a little over a year ago, to do a collaboration survey. And it was a multi-question called Wilder Collaboration Survey. And one of the questions was that we did really, really well in Santa Cruz County overall on that. And one of the areas that we were least strong in was, I understand what the goals of the coalition are, and I understand that we're moving towards them and how we're moving towards them. And of course, as is human nature, you always remember the slightly negative feedback. And so that really stuck with me, and I thought, you know, I think part of that, and feedback is helpful and we can always do better, I also think that part of that is, look at these aspirational goals. I mean, this is mountain moving, right? But I also know that what is so rich and so beautifully in the room today is that concept of this no wrong door approach and being person-centered. And so before I pass this along, I wanted to share really 2 quick little stories that I know that what we will foster today, my committed request is that, as Jen said, that you make connections with people from other communities that you don't already know and learn details of their programs that you might bring to fruition in your location, and that you read the packet, because there's some really rich stuff there. And also that we all, despite the complexity and the frustrations, that we all remain rooted in that deep desire to better serve people in our communities who are in need. So my story is my first time meeting Eric Riera, who is Director of Mental Health in Santa Cruz County, was with former Executive Director of HIP, and we were talking about the need to coordinate the care coordinators and what that looks like and how complex it is. And he quietly leaned in and said, let's also make sure that the people for whom we're coordinating care want what we're offering them. And that is, I think that just says it all, right? And then the other little story, very quickly, that I'll share is, you know, my voice is ugly today, I apologize. And in not feeling well this week, I felt like, come on, this is not fair. This is what I've been working towards for a long while, and together with all of you in the room. And so yesterday I dropped my children, they're 8 and 9 at school, and the school was on lockdown. They got to the front door, and this woman, literally shaking, came to me and said, go, if the kids are in, you go. And if they're in your car, then take them with you. So, long story short, what happened was there was someone who I suspect was probably altered on drugs. Someone was slumped a block away from the school, slumped over in a vehicle. Someone reported that they thought they saw a weapon in the vehicle as well. So I think the school did what was very appropriate, and it was handled well. It was a 10-minute deal. But in that moment of like, oh gosh, there's so much going on and all that fear, I also felt so strongly, you know, that person in the car is why we're here. That's why we're all in this room together today in this beautiful location to learn from each other. So that's all I have to say. The other housekeeping thing I'll say is I have a bell, and I will ring my bell if I need to. And those of you who are presenting, I've asked HIP staff in the back to hold up signs, and so only if you're way over will I ring my bell, and I'm up front. Thanks.
So you just witnessed the passion that I get to work with every day. Thank you, Shelley. So we're already behind. Okay, so we had a mapping exercise, and I'm going to have to telepathically go to Shelley. I think we're going to just take a few minutes. This is this grid here, and I'm also going to point out the colorful diagram, behavioral health care stream map that was done at a retreat that we had sponsored by our Santa Cruz Medical Society. Don Hernandez is here for that. And we kind of put the patient in the middle and looked at all the different structures, supports, people, both hardscape and non-hardscape stakeholders for serving our patients. So we kind of like this idea as a way of doing mapping, but just briefly, there's lots of money coming in. It's wonderful, and it seems to me it serves a lot of the same clients. So instead of doing the mapping right now as a group, which we were going to do, I'm just gonna say, take a look, think about your county, drug Medi-Cal expansion, which is the 1115 waiver, and in our county now has the acronym Organized Delivery System, or ODS. There's the Whole Person Care Pilot, which is federal money coming through the state. Does your county do this? Yes or no? The hub and spoke model is also federal money coming down to increase access to medication-assisted treatment. There's the Alliance Intensive Case Management. So this is Central California Alliance for Health, which is in 3 of the 4 counties that are mentioned today, Monterey, Santa Cruz, and Merced. And then there's Beacon Health Options, which is providing our mental health for mild to moderate, and we have our county mental health. There may be other programs or infusions of money that you can think of. Through the day, we're hoping that you can take this grid and fill it in. If you can't fill it in, find someone who might help you. And then at some point, we want to perhaps take that information and put it on a bigger paper and put it up. But just, I've been doing this for a bit, and I keep confusing whole person care and health homes, and I don't know which does what, and I'm doing this. So if I'm confused, if you're just new to this, it might be very confusing. So we're hoping that this process of looking at all the infusions of money will help separate it out and get it a little clearer in your minds, and hopefully it'll be clearer in my mind too.